Innovators at Makerere University College of Computing and Information Sciences are revolutionizing medical diagnosis by using artificial intelligence, machine learning, and robotics to detect diseases faster than the traditional system that takes doctors hours to get testing results from laboratories.
We have a very big, public health burden in terms of the experts to be able to diagnose some of these issues. Currently, if you look at the ratio of pathologists to the patients that they receive, it lies at 3,000 patients per one pathologist. One of the things that we've been doing at the lab is to be able to support diagnosis of some of the most pressing health challenges, for example, malaria, cancer, tuberculosis, intestinal parasites, where we rely more on the use of the microscope to support the diagnosis of such diseases. But the limitation is the lack of the expertise to use the microscope to support the diagnosis of such disease challenges.
What happens is that a microscope is directed into a specimen and a smartphone is mounted onto the eye of the microscope to show the enlarged image. Here, the collected image is then passed through the AI model directly through an adapter where it does detect the degree of parasite in, for instance, a blood sample.
We get examples of, for example, malaria parasites or any other TB bacilli that we want the artificial intelligence model to learn. It learns on those examples. Those examples are given to us by the experts who annotate out those parasites, and then we feed that information to the artificial intelligence model to learn them. What has been taking a pathologist like 30 minutes to spot out those parasites, this time around it's actually the model directing them, to where these parasites are and even showing them. Through Ocular, we are able to not only detect, we go further to quantify, and then a patient is actually told that you either have malaria and malaria in this magnitude.
The use of artificial intelligence is growing across medicine, particularly in the diagnosis of diseases. This interest is particularly easing the traditional diagnosis approaches, which are manual and time-consuming. The challenge lies in the scarcity of data needed to train these models and funding needed to make the prototypes viable startups. Ndagire, NTV Business.